Hello, everyone. Welcome to JA Explained. This episode is all about medical transitions and how you, as a parent or caregiver, can help prepare your child today so that they can better manage their care as young adults. My name is Jennifer Burke, and I am from New York State. I'm a wife, I'm a mother of three. My youngest is a senior in high school and was diagnosed at the age of 10 with juvenile arthritis. It's really important to me to set kids up to be able to manage things on their own. One of the neat things that we did was go to the 2023 Arthritis Foundation Family Summit, and that happened in Atlanta, Georgia. And at this location, had the amazing pleasure of meeting Dr. John Bridges. Dr. John Bridges is a combined adult and pediatric rheumatologist at the University of Alabama in Birmingham. And his clinic and research interests include improving outcomes related to pediatric rheumatology care as patients transition into adulthood. Now, Dr. Bridges is also the founder and director of the Bridge to Adult Care from Childhood to Young Adults with Rheumatic Disease, the BACC YARD program. And that's a pediatric to adult rheumatology transition program. So, Dr. Bridges, I want to thank you so much for joining us and welcome to the conversation.
Yeah, thanks for having me. It's good to see you again, Jennifer.
Absolutely. So before we get started, Dr. Bridges, can you just kind of describe what it really means to say medical transitions for a child or a teen that is growing up with juvenile arthritis?
Yeah, sure. So when in the rheumatology world, when we talk about transitioning, especially in the pediatric rheumatology world, we're talking about transitioning from a pediatric model of care to an adult model of care. So going from seeing a pediatric rheumatologist to seeing an adult rheumatologist. Um, so it's while there is a single transfer that happens when you go from one clinic to the other, transition is the name that we give to the whole process. That's kind of this long process, as you well know, Jennifer, of developing the skills and kind of mindset necessary to be front and center and driving your own healthcare as a young adult in the adult rheumatology world. It's a little bit different than the way pediatric rheumatology goes.
So you said that helping our children make that transition from pediatric to adult rheumatology kind of starts with taking some simple daily steps and not really waiting until they turn 18. So how do we know like when it's time to give our child like certain responsibilities or certain levels of care?
Yeah, so this is a question I get a lot, and it's definitely child dependent. But in general, most kids around the time they're in grade school, so like primary school, the skills that you're working towards to kind of building blocks to build on for eventually successfully transitioning, really in that primary school age, or using the right language to describe their disease and maybe to describe some of the symptoms that the doctor asks about, getting your son or daughter to engage with the doctor during the visit and answer some questions is what I would expect at that age. As the child gets into middle school, paying a little bit more attention to tracking symptoms and being able to kind of put a timeline together from what happened from last visit to now is what I would expect. And then as they go into high school, being able to spend some time talking one-on-one with the doctor, and kind of taking the lead and asking questions is what I would expect. A lot of this, especially in younger high school, involves a lot of parent coaching, hopefully before and after each visit, to build that skill set, because it's not a natural thing to really develop. So this takes a lot of coaching, I guess, from the parenting perspective, is how I like to think about it.
Yeah, it kind of reminds me of one of the things that we did as Liliana grew up is we used to kind of have like a pre-appointment meeting in the car talking like, okay, what do we need to discuss? What are a couple things that you're going to bring up? Or what are some things you want me to handle at this appointment? And then we would have the appointment. And then on the ride home, we would kind of debrief and talk about what went well, what they wish they would have said, and things of that nature. Is there any other suggestions you would have for coaching along that lines?
Yeah, I think the pre-meeting and the debrief is a great way to do it, and a great way to make sure everybody's on the same page during the visit. It's as the doc, sometimes it's hard when the patient's telling you things are fine, the parents telling you things are horrible, and you're like, well, where's the third bet here, the through line. But yeah, so doing that kind of pre and post coaching, and then just kind of helping your child kind of generate some thoughts about like, oh, well, you know what, as much as you can get them to take stake in how they think things are doing and kind of having some buy-in, that's when they're going to develop those decision-making skills. Like, yes, this is something I want to talk to the doctor about, or, you know, I need some more information first before I want to ask the doc about it. So coaching is a great way to make that happen.
Real talk. I'm guessing there's some parents out there that are watching and listening right now having a slight panic attack because their kid's almost 18 and they haven't even started thinking about transitions. Can you give some advice to those families?
Yeah, so that's also a common scenario, is you kind of 18 happens before you know it. It sort of feels like for some parents, but the best time to have started planning for transition is yesterday. The second best time is today. So regardless of where you are on that journey, just kind of thinking stepwise through where my child is and where I want them to be as far as taking care of their own health. And then not quite baby steps, but sequential kind of building up steps to get there. So the first thing may be figuring out what the transition policy of your pediatric clinic is. So some providers, you know, once you turn 18, it's the clock is ticking to go to an adult rheumatologist. But some other groups will hang on to patients until they're well past secondary school or their first job or whatever, where other things in their life are a little bit more stable, and that's a good time to make a transition to a different doctor team to take care of their disease. But first is knowing when your expectation of that timeline is, as is dictated by your pediatric rheumatologist office and geographically where you're located, and then kind of going from there of setting some goals and saying, okay, what do I need to accomplish my son or daughter to be able to fill their own prescriptions, or to talk to the doctor about symptoms, or to know what a specialty pharmacy is, things like that.
Dr. Bridges, so we talked about, letting go a little bit and allowing our child to kind of have more care for themselves. And I know as a parent, we've done this in different ways. And one of the things that a lot of parents are curious about is when this surrounds with medicine, and how do we allow the child to take some care of their own. In our home, we did a slow transition. At first it was um, more me managing medication and making sure it was taken, and standing there and watching. And then we went to a system where I we still use a system. We have a course of the month. I go with her, and she divvies up all of her meds, and we have it in a month long thing with all these different things that she picks up, and everyone has a date on it. And then I can go and kind of check to see if she actually took the medication without being that nagging parent, and making sure. But if I notice a couple days of not taking, I might say something. And we did go through a time where she was just like, I'm kind of over meds. I don't want to do it anymore. And working with the doctor. But when is enough? Like, when as a parent are we able to kind of let go, and when do we kind of need to step back in?
Yeah, so this is certainly a tough question, and it gets kind of complicated, and depends on what disease you have that you see a rheumatologist for, and if you're in remission or if you still have active disease, and a little bit of like a judgment on how responsible a particular patient is, which from a doctor's perspective, it's very hard for me to, even when I know a patient really well, I'm having 30-minute encounters, 30 to 60-minute encounters with most families every few months. So it's hard to judge when a child is ready to take on that responsibility. And so a lot of that falls on the parents, and it's a hard answer to know. But I really like your point about kind of small steps towards independence, because if you have small steps and kind of an ability to check on how medicines are being taken and things like that, that that means you kind of got a safety net, right? They're not going to fall through the cracks. You're not going to have a huge disease flare. It may be, oh, I noticed that you're only taking 5 out of every 7 pills. You're like forgetting to take pills on the weekends or things like that. And so that's a good way to keep an eye on things. And as long as you're still going to appointments, getting your labs, like we'll be able to tell if things are getting out of control. It gets a little bit tricky with some of our medicines that we need like specialty pharmacies for and infusion scheduling. The responsibilities that come with that are a totally different level, right? Like there's taking pills once a day, but then like being able to schedule my infusions and calling a specialty pharmacy and making sure things get delivered, like that's hard for a parent to do, right? This is like a totally unusual skill set that a lot of our audience has developed. And for that, I'm much more lenient in letting parents be involved for longer if they feel ready. So I have a lot of students that are patients that are students at college or things like that, and their parents are still driving the ship as far as making sure specialty pharmacies get delivered, get the deliveries, and get the medicine where they need to go. Just because that's complicated. And the way to successfully transition that across is that at some point during the middle teen years, start cluing in your child to like, hey, I talked to your pharmacy today, or I noticed that we were out of our month's supply of whatever biologic you're on, and kind of cluing them into the weird rhythms over the course of weeks to months that you have to be clued into to successfully keep yourself on a medicine like that. And that's a long game, right? It's not like I'm going to fix this today. It's like over the next 5 years, I'm trying to help my child be able to manage this themselves. So it takes a lot of foresight and a lot of planning on the steps to go from, A to Z to accomplish that.
Right. Yeah, we had kind of an aha moment with the infusions because my daughter has infusion schedule, and just happened that I have gone with her to every infusion, and my husband and I were not going to be in town when she needed her infusion. And I was like, you know what? I'll just reschedule stuff. We'll be here. And, our 17-year-old daughter said, well, wouldn't this be a good time for me to help, learn this? And so her grandmother took her to the infusion. We had it all cleared with the hospital that, and she took lead. She scheduled her next infusion, and she said, isn't this a great practice because you're still here? And I was like, wow, yeah, this is. And so we were kind of able, by a little push, able to even transition with that. And I think sometimes in those small moments, we get big steps. Well, before we sign off today, I do want to remind parents that the Arthritis Foundation has several resources that can help you better manage your child's arthritis. This includes the Live Yes Connect group, which meets in person or online. And in these support groups, you will actually meet other families and parents who really do get it. They understand what you're going through. And together with the help of experts, you'll kind of learn new ways to help your child and to help yourself and have everybody cope better. The foundation also hosts webinars, podcasts. They have several toolkits that can help you care for your child with JA. You can go to arthritis.org/JA for more information. And I want to thank you so much again. I want to thank the Arthritis Foundation for hosting episodes like this that I know from a parent perspective changes everything. And to Dr. Bridges for sharing his expertise.